Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I am your host, Dr. Emran. On today's episode, we have a very special guest. His name is Juan Morales, and he is the CEO of Longevity Media Solutions based here in Houston, Texas. Now, Mr. Juan Morales is a very experienced ER nurse who launched his own company, and we are very delighted that he chose our show today to discuss some of the topics in health. So thank you so much for Juan for joining us today.
Hi, Dr. Emran. Thank you for having me today. I really appreciate you doing shows like this to help educate people and to help grow throughout the healthcare community.
Wonderful. Thank you so much. I know you're a very busy person. Tell me a little bit about your background. You had mentioned that you've done some ER work in the past.
Yeah, so I've been in the ER since May 2007, worked here in Houston, different hospitals. I did some travel nursing, and throughout that ER journey, the ER experience, which a lot of your listeners are familiar with, is it can be very rewarding in terms of helping people, right, in critical conditions. But a lot of the patients, the type of situations we see could have been prevented. I think I'm accurate in saying that maybe 80% of ER visits could have been avoided or were unnecessary. So that's when I started my path of figuring out how do we keep people out of the ER, and that's when Longevity Media Solutions was born.
I see. Very good. And tell me a little bit about Longevity. Where did the name come from? How did you choose the name for this organization?
That's a great question. So longevity, I like to think in terms of longevity to make decisions. So as an example, it could be something as simple as, should I eat this today? Long term, what kind of consequences will this have? And then in the business sense, it's, should I work with this practice? Should I work with this person? Are we compatible? I like to think in terms of long-term commitments, and that helps you kind of prioritize, kind of a triage process for me is, hey, do I see myself doing this in 5-10 years? Is it going to matter? Is it going to make a difference? And I use this word just to kind of reset my mind and help me focus on doing things that matter.
Wonderful. Now, that makes a lot of sense. And I think you take a wise approach, meaning everything has a short-term benefit, but also a long-term benefit. And I think you're very correct in saying that the things we do today will definitely impact us in the weeks, months, and definitely years ahead as well. Now, tell me a little bit about the specific goals that Longevity Media Solutions provide. So you work with physicians and you work with clinics throughout the Houston area?
Yeah, so ultimately I see myself as a physician advocate. And what that means is I realize that doctors, they're very busy and they don't do a great job of promoting themselves and kind of putting themselves in that position to where, hey, I'm board certified and this is why, you should trust me. I've done so many surgeries of this kind of surgery, and I'm really good at this. So we go with practices, with doctors, with urgent cares, and we do an assessment, and we figure out, okay, what are your strengths and what are y'all really good at? And then we use social media platforms to promote them, to promote their services, their background, their education, so that we can position them in a way to own their zip code. So if I suffer from cardiac problems, I want to know who the best cardiologist is in my area. So we help doctors kind of promote them throughout their communities. Part of that process is establishing their online presence, making sure, all their reviews are good and promoting them. And I don't know if you know this, but 88% of consumers will check an online review before they purchase a local service, and that especially applies to healthcare. So we put the doctors in the best position so that when people find them, they call them and use their services and book an appointment. And the long-term goal is that if we can educate people and connect them with preventive primary care or specialist care, then we can avoid unnecessary ER visits.
I see. Very good. And I agree with everything you just mentioned. I think a lot of doctors, even though they are very skilled, as surgeons or psychiatrists, or they do different procedures, during medical school, I will have to say that I don't think they teach any business skills, and they really definitely don't teach anything about social media management and how to market your own skills as a professional out in the real world. So I think you're very wise in tapping into that market as well. Now, tell me about some of the challenges. So you mentioned that online there's reviews, some are good, some are bad. So what are some of the challenges that doctors face in today's world in managing their social media profiles?
The challenges are that healthcare doesn't change or evolve as quickly as technology, especially digital technology. So I think at the core of it, there's a fear. Hey, if I put myself out there, now I'm putting myself at risk for HIPAA violations or, my reputation. People can now, there's certain factors we can't control, like a long wait time, because we have so many patients, and I just don't want to put myself out there because then I'm going to have all these negative reviews. But what we do is find a way to automate a lot of these procedures so that we're able to facilitate that access to care and kind of help them establish a streamlined process for patient intake. And the other part of that is that there's a lot of news out there, a lot of stuff that isn't necessarily always accurate. And I think it's important for us as healthcare providers, the frontline providers, to kind of put more effort into giving accurate data so that people know, hey, I'm having stomach pain. What could this be? They know that they have somebody locally that they can trust instead of maybe going and doing a Google search online and getting information that isn't necessarily accurate. So I think it's a combination of making or helping healthcare become more transparent and promoting them. And what I think we do the best is we make it safe so that doctors can do this without putting themselves at risk for a HIPAA violation.
Sure. No, I agree with you. And I'm glad you mentioned the Google, and I sometimes call it Dr. Google. Because when I work in the ER, every day I have people who come in with a printout or something on their phone. Maybe they've looked up something about a toe infection or something about a rash on their body, and they are convinced that they have melanoma and it's already spread to their eyeball and it's spread to their fingernails. And so they come in thinking the worst. And I always have to sort of calm those people down that, Dr. Google isn't really a doctor. It's just information that's out there. And most of it doesn't even apply to that particular person. But I think it creates anxiety. I think it creates a lot of negative feelings. And that's really not what healthcare should be about. I think that we should, as you mentioned, promote the skills of the doctors who really can help you, and also to advocate for the patients to keep them out of the ER, keep them out of the hospital, and really connect with better doctors in the community.
Yeah, that's so important, and it all comes back to if we can educate and give people those options so they know it up front, they now can make better decisions and ultimately just have healthier communities that understand the long-term consequences of these chronic illnesses, right? And I say this from experience especially with the Hispanic population. Every time I would get a Hispanic patient over a certain age, I knew they had 3 conditions, right? They were going to have diabetes, high blood pressure, and high cholesterol. I could already check it off my box, right? And when I would talk to them, I would ask them, so why do you have diabetes? Just to see what they thought caused it. And I always got the same answer. It was, well, it's just my age. It's just, my normal aging process. And in those moments, although that is a contributing factor, that's not the complete story behind why you got this diabetes, and also understanding that, hey, if we don't keep this under control, this can lead to visual problems, neuropathy, renal problems, and just helping them truly understand, hey, this will lead to this over a long-term period. And that alone is very powerful. And in the ER, we just don't have the time or the opportunity to give that effective teaching. So that's why it's important to have this type of educational content out there, that's accurate, that's precise, that's evidence-based, that's going to truly show people, hey, this is diabetes, and this is what diabetes does over long term, and the chronic consequences from this illness.
Absolutely. No, very good. And those of you just joining us on the episode today, I've been speaking with Juan Morales. He is the CEO and founder of Longevity Media Solutions, based here in the Houston, Texas area. If you want to connect with Mr. Morales, if you have a clinic or if you have another healthcare organization that would benefit with his services, his direct phone number is 713-303-1393. Again, that number is 713-303-1393. Juan Morales is the CEO of Longevity Media Solutions. We will have a lot of his links and social media contact information on our blog very shortly. Juan, tell me again, so you mentioned the Hispanic population, which has a very unique set of challenges. Is part of it based on cultural factors, or is it more based on language barriers? What have you found to be sort of the reasons that that particular population of people seem to have a large risk of diabetes and high blood pressure?
It's a combination. You mentioned cultural factors. The Hispanic population in healthcare in general, there's a different approach in, say, Mexico or different countries to healthcare. And then the language barrier, makes that worse. If you don't feel like a physician, and it's nobody's fault, but, when we're in a situation where, let's say a primary care doctor has to see 40 patients a day. They don't have time to really sit down and get to know this person, or maybe get a translator. And now we're relying on their kid, that's 8 years old, to translate. So from the beginning, I think the Hispanic population, they want to feel that, we care more and that we're listening to them. And that applies, to all cultures. So a lot of this is for the Spanish-speaking doctors finding ways to expand their reach. Some of the ways we've done that is offering telemedicine, which is another one of the services we offer, is where we're able to connect Spanish-speaking doctors to a telemedicine platform with the goal of them being able to reach more people, especially here in Houston with a Hispanic population of 42%. And what this telemedicine program does is they can connect with a doctor that understands their culture, that can treat them or at least guide them into what they should do next. Or it could be something as simple as a prescription refill, right? Being able to refill that high blood pressure medicine so that they don't come into the ER with a pressure of 220/110, right? With now a stroke.
Sure.
So we're very unique in terms of we'll do whatever it takes to provide that access to care in the best way possible, using technology to help reach more people.
Wonderful, wonderful. Well, you've taught me a lot on today's episode, so thank you so much for clarifying some of those points. Again, we've been speaking with Juan Morales. He's the CEO of Longevity Media Solutions, based here in the Houston, Texas area. If you or your practice would like to connect with him, his direct phone number is 713-303-1393, and I will have his contact information on our blog very shortly. Mr. Morales, do you have some final thoughts that you would like to share with us, or some questions or ideas that you want our listeners to be aware of?
Yeah, I would just like to take this time to thank you for doing this. I think it's important for us as frontline healthcare providers, nurses, therapists, physicians, ER physicians, to be the ones that start solving healthcare's problems. I think it's ultimately going to be up to us for these changes to happen. If anybody has an idea or maybe doesn't know where to start, reach out to me. I'm here to help. It's going to be up to us nurses at the front lines, right, that understand the problems in healthcare. I know it can be frustrating trying to work through hospital systems to make change, but I guess my message is, hey, there's other ways to do this at a community level, and we can truly make a difference if we start looking at problems and seeing them as opportunities to create healthier communities and create solutions for those problems.
Wonderful, wonderful. Very good. Well, thank you again, Mr. Morales. I really appreciate you making time to be on our show today. I'm glad that we had a chance to connect. You've been listening to Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we had Juan Morales, the CEO of Longevity Media Solutions. He discussed a lot of different topics about ER visits, the long-term consequences of our healthcare system, as well as some new ways of